Evening, everyone, and let's start our meeting with a silent prayer for 1 minute. Good evening and welcome everyone to our Zoom session. Now let us start our meeting. I know all of you already know about IFPH. Shall we start? Dr. I think already our guest joined. Dr. Ismail said, okay. Let me say a few words about IFPH. Already all of you know about IFPH, but those who are attending today's meeting for the first time, I just say a few words about IFPH. International Forum for Promoting Homeopathy is a non-religious and non-political organization formed with the interest of homeopathic lovers. Our only intention is to promote homeopathy all over the world and unite the homeopathic doctors together in one platform. This organization is different from many other homeopathic organizations because this is not the organization of homeopathic doctors, but this is the organization of homeopathic lovers, homeopathic wishers, and homeopathic doctors. And many people from many fields of life are with us, and today is our 359th Zoom session. For the last 358 days, continuously we are conducting the Zoom session without any break. And within few days, we are completing our 1 year. So many doctors from different parts of the world joined with us, and shared their experience and views and suggestions with us. So we are successfully continuing our journey, and many people are inspiring and supporting us. Thank you everyone for your support. And today's our guest is Dr. Partha Pratim. He is a research officer in CCRH and working currently in Dr. Anjali Chatterjee Regional Research Institute, Calcutta, and under CCRH and Homeopathy Ministry of Ayush, India. He is a rank holder. When he got his BHMS, he got second rank in his BHMS. He completed his BHMS from Kolkata Homeopathic Medical College, and for the MD entrance examination, he got third rank in All India level, and he completed his MD from National Institute of Homeopathy. We are so pleasure to invite you, sir, Dr. Partha Pratim. Please welcome, doctor. Please, you can talk now.
Thank you so much. Am I audible?
Yes, sir. Yes, you're audible.
Okay. Thank you. It's a pleasure to be a part of IFH and to present a presentation on a case report. And thanks to IFPH, who actually, as I came to know, basically, that it belongs to a forum basically of homeopathy lovers, and really love to be a part of this forum. So thank you so much to give an opportunity to speak on this platform. And I already mentioned in the presentation, probably you have already seen that today I am going to present a presentation on a case report, and which is basically on Ranula. Ranula, probably something which you not very often encounter in clinics, but is one such cyst which you generally found in the oral area, oral mucosal. So better I go into it, and as I share the presentation in the PPT format, I think it will be more clear to all of you. So I would like to share the screen. I am doing it. So is the screen, is the slide visible?
Yes, sir. Yes.
I'm trying to make it full screen. Is it full screen now?
Yeah, not full.
Okay, I'm trying to make it full screen for better visibility. Yes, just see it now.
Yeah, it's full now.
Okay, so to begin with, as I told you, so it's basically an obliteration of ranula, means ranula ultimately disappears with homeopathic treatment, which may be a magic for the other conventional mode of treatments, because ranula most often is considered to be a uh, surgical disease, and it needs some surgical maneuver to get healed, but it's not always in case of homeopathic treatment. And homeopathy has been an evidence of such situations where many surgical cases, which was so-called surgery needs to be healed by surgery, is ultimately healed by homeopathic treatment. So one such case is this one, and this was actually a case of a female child with a painless cystic swelling in the right side of the floor of the mouth, which was actually developing for the last 3 months, and painless cystic swelling was also found in the same child uh, in the lower lip, in the right side of the lower lip. So it was, as I am telling you, that this is basically a case of ranula, but along with ranula, there was again a cystic mass, a small cystic mass, which was actually present in the inner side of the lip, which I will show you in the picture. So it was actually two cystic mass, if I say. The one was which may clinically was diagnosed as ranula. The other one was just a retention type of cyst, and it was in the lower part of the lip. And after individualizing the case through miasm, through repertorial and analysis, going through the symptomatology, the homeopathic medicine, Ambra gracia, was the repertorial as well as the mathematica selection. And in pluripotency, it was given. And within 2 to 3 months, as you will see in the follow-ups, the ranula ultimately disappeared. And the other cystic swelling, which was also there in the inner part of the lips, that also simultaneously disappeared. So that's the basically magic of homeopathy, which we don't consider to be a magic, because this is what homeopathy has the potential for. And just going into the case proper and a little bit about the disease which you should know. So it is means a ranula basically is a soft translucent swelling that occurs in the floor of the mouth, usually causing mild discomfort to the patient. The term ranula actually is derived from the Latin word rana, which means frog actually. And the ranula describing, actually it looks like the belly of the frog most of the time. That's the frog bulging under the belly. So its resemblance is like that, and hence the name will derive from there. So as per the definition, it is actually a extravasation cyst arising from the sublingual gland or mucosal gland, in most often found in the floor of the mouth, and occasionally it may also occur in the submandibular salivary gland also. The types, as you can understand, basically sublingual, or it may be submandibular, or it may be totally submandibular. The sublingual and the simple sublingual ranula, which occurs in the floor of the mouth, is a very simple ranula. The other two varieties, which is sublingual mandibular and submandibular, they actually presents a group of plunging ranula. Now, what is this plunging ranula? This is needs to be known a little bit, because this plunging ranula is something which may not be an easy case in the clinics. It might not also get, annihilated through proper medicine also, because it is more surgical in that way. So what is it? It is a plunging ranula is a very rare one. First of all, it's again a mucus retention cyst which arises from the sublingual and the submandibular area, and mucus collects around the gland, and hence the name is mucus retention cyst, and penetrates the mylohyoid diaphragm to enter the neck. So you can see that in this plunging ranula types, there will be a swelling which will be quite visible from outside, even below the neck, because this dumbbell-shaped swelling, which is very soft and fluctuant and often painless, it also appears below the below the mandible, below the mylohyoid process, and it's visible quite outside on the neck area. Otherwise, the normal simple ranulas really are not visible in the not visible from outside, or it's not practically visible as a swelling on the part of the outer part of the neck. So my case was basically a simple ranula, not a plunging ranula. But still, even simple ranulas in modern conventional medicine goes only for surgery. Now, always a swelling in the floor of the mouth need not to be a ranula. So before going to the ranula or the case proper, I like to discuss a little bit regarding other differential diagnosis which you need to think about when you encounter such cystic swelling in the floor of the mouth. First of all, it may be a very much tongue muscle atrophy, or it may be a lingual thyroid tissue, which is a kind of pseudotumor, not a tumor proper. And this tongue muscle atrophy is very easily understandable if you just go for the examination of the cranial nerve 12, the hypoglossal nerve, which is related with the movement of the tongue. So in that way, you can easily diagnose whether it's a tongue muscle atrophy or something else. Lingual thyroid tissue, it will definitely have the texture histopathologically, it will resemble thyroid tissue. And by that examination, you can clearly differentiate out. Inflammatory lesions like cellulitis or abscess, or Ludwig's angina, which is also a type of bacterial infection and which is pretty much uncommon in children as well. That has to be kept in mind. And subdilated submandibular gland duct, which might be from a calculi. So they will have own infective features and obstructive features accordingly along with the presentation. So by that you can differentiate out. But what is the most difficult part during this clinical diagnosis will be these three cystic swellings, which you need to consider one from the other. We need to differentiate one from the other. For example, regarding ranula, lymphangioma, and dermoid cyst, these three things are such three things which is actually very close to each other, and you need to differentiate one from the other carefully. So a ranula, as you know, it's most of the time it's basically, I think it will be better if I show my the ranula of my case once, and then I will come back to the description that will help you to understand. So see, so this is actually the first day when the patient came to me on 4th of April 2019. So this was the ranula which was present in the floor of the mouth, in the sublingual area, a little bit of bent on the right side, as I told you. And along with the other one, the second picture, which is you are seeing, this is a cystic swelling, which is appearing in the right part of the lip, in the lower part, inner side. Now, this is how a ranula generally looks like. Means it will be basically bluish as basically the textual reference if you go through. But it's not always, it has to be bluish, but definitely the blood vessels and the surface will be quite visible on the superficial layer of it. And when you compare this along with lymphangioma, compare with the lymphangioma, which I have written as a first point of DD, lymphangioma, which may be a cystic hygroma also. That lymphangioma is basically a mass of, proliferation of a lymphatic vessels. So in that way, the surface of that lymphangioma will never be as smooth as you just saw in the picture for the ranula. Surface for the lymphangioma will be very much having elevated nodules, and the surface will be very much rough, not smooth as you have seen in a ranula, which I have shown you. And regarding lymphangioma, one more thing that is basically is present from the birth. Most of the time, it's basically congenital and very often less acquired, which is the case in most of the time. They are mainly acquired. But lymphangiomas are basically congenital, which may appear at the birth or maybe appearing later on during dentition, or it might also appear after puberty. It may have a late appearance or late discovery, better to say. We understand that there was a lymphangioma many years later, but actually it wasn't right from the birth. So another point of difference is that the features of lymphangioma basically they present most of the time with macroglossia. Most of the time there are features with impaired speech. The patient generally have problem with the speech. The patient might have difficulty in mastication, which might appear in ranula as well, depending upon the size of it. But macroglossia is not something which you can expect in a ranula, but most often mainly found in lymphangioma. And lastly, if I compare another very close one, which you need to differentiate out, that is dermoid cyst, dermoid epidermoid cyst. The dermoid cysts are basically, remember one thing, they are most of the time they are midline. They have a midline occurrence, and if you see, they also have a congenital as well as an acquired timing of appearance. So midline is quite important, and in this case, you can see ranula was basically tilted on the right side. It was basically found on the floor of the mouth on the right side, not exactly in the midline. And one more thing in the dermoid cyst is that if you go through the literature, you will find that dermoid cysts are basically common in the head and the neck, and very, very less common in the floor of the mouth. So floor of the mouth for dermoid cyst has the least percentage of occurrence. It's around 6%. And 84% of it basically occurs around the head and the neck. So in that way, you can understand that dermoid cyst, floor of the mouth is not a choice, basically. So ultimately, in the cystic lesions, which is according to the floor of the mouth, you generally, most of the time, you get what is actually a ranula. The other thing are benign tumors, which may be either benign, either maybe a hemangioma or a pleomorphic adenoma. And as per the tumors, as you know, tumors are overgrowth of the cell of the gland. So ultimately, there will be the respective features of that overgrowth, whether it's a benign or malignant. And accordingly, the systemic features will also come in, and it will be easily distinguishable. You will not have a confusion with that. So these are the DDs which you need to know and you need to make when you actually encounter a case of ranula or anything in the floor of the mouth. Okay. Plunging ranula, I told you. So just a little bit regarding the pathophysiology and histology. Ranula is an extravasation cyst which arising from the sublingual. Okay. So pathophysiology, ranula is an extravasation cyst arising from the sublingual gland, mucous gland in the floor of the mouth. And this occurs due to why? Due to the herniation of the mucous skin through the mylohyoid muscle. Histopathologically, if you see, it's microscopically, it has a delicate capsule, which is lined by a layer of macrophages and contains clear fluid with a thin wall. Prevalence data, since my case was dealing with a simple ranula, so simple ranula, as you can see, is quite common during the first and the second decade of the life. And my case proper also contains a child of 12 years age. So it quite goes with the data which is available. Next, while plunging ranula, which I told you is the most dangerous form and mainly a surgical form, which occurs frequently during the third decade of life. Females are commonly affected than the males. And treatment, the conventional treatment, which actually goes for ranula is marsupilization, which has a high occurrence rate, and 50% is a chance for recurring again. Excision of the cyst with sublingual gland reduces recurrence rate by 2%. But whatever it may be, unfortunately, this most common complication of this kind of procedures are the recurrence of the lesion, as I told you in the first line, and there may be some sensory deficit of the tongue as well, which may be followed by the damage of the Wharton start. So these are the complications of the surgery, and the surgery itself has a prognosis of having quite a bit of recurrence. So this is the modern data which is available for ranula. On the homeopathic perspective, if I made a thorough search regarding the literature which is available for ranula, there may be many doctors who may be listening to me today or maybe listening in the video later on, who have gone through cases of ranula, might have treated cases of ranula. But unfortunately, my appeal to the whole homeopathy fraternity is that whatever treatment you are doing, whatever successful treatment you are going through, try to document somewhere so that it comes to the modern world and people come to know that. For example, when I made a search for the regarding the cases of ranula available in the internet through even popular search engines like PubMed, Medscape, Science Direct, etc., there was no such evidence-based case documentation found for the treatment of ranula in homeopathy. But definitely, this doesn't mean that people are not treating ranula. There are doctors who are treating ranula, definitely, but this is my appeal to all of them that please bring them in front, highlight them, get them published so that everybody comes to know and get enriched with the knowledge of your cases as well. So only one case found, which was uploaded in the website, and it was pictorially documented as well, like my case, where a ranula of duration of a few weeks was found in a 7 years child, and it was cured with Thuja 200. So this was the gist of the case which I am telling. In this case also, there was Kent which was used for hepatization. Unfortunately, I found that only few rubrics was considered in that case. It was having only 2 general symptoms and 3 particular symptoms. And the reference for that I have given in the lower part of the bottom of the slide. You can go through, you can take it down and refer to this particularly. And documentation was done by photography, as I told you. Thuja was the prescription. And if you go to the Materia Medica, you will find Thuja is also a very specific medicine for ranula, as mentioned in the homeopathic Materia Medica. And although the above prescription was not just specifically given that it's a ranula and go for Thuja, it was not like that. It was given after the analysis of the symptoms and the 5 symptoms also, but it was done only after the totality, after the analysis of the totality. So now this was till now what was available for ranula in the world regarding the allied part as well as the homeopathy part. Now this is the case history of the particular case of mine. And as I said in the beginning, that it was a female child of 12 years age with plain of painless cystic swelling in the floor of the mouth, right side, which was gradually increasing in size for the last 3 months. And it was now, at the time she came to the clinic, it was around the size of 3 centimeter by 3 centimeter approx. Means it's actually 3 centimeter. Means centimeter means it's 30 by 30 meter. It's quite huge in that way. It was huge in such a way that it was having a little bit of obstructive problems for the child as well. So the surface was smooth and glistening, which you saw. So once again, I can show you. The surface was smooth and glistening. And just look at the picture and accordingly, you can just see. There were visible dilated vessels, as you can see in the superficial surface. The vessels, the capillaries were quite visible. So visible dilated vessels, and the mucous membrane was freely mobile, which I can show you, but it was during examination that was elicited, that the mucous membrane was freely mobile on the cystic mass. And the swelling was found to be transilluminate. You know what is transillumination. Fluctuation was also positive. These are actually features which goes in favor of ranula, because in most of the time, if it is a lymphangioma, which I missed out, in lymphangioma, it will not be a transilluminate swelling, but ranula will be a transilluminant swelling. So along with this, small other mass also developed. You can see in the right hand side picture. And that cystic mass in the lower side of the lip, which was painless and was having a smaller size, which was around 10 millimeter by 10 millimeter. And along with that, she had some other complaints. I will come to those other complaints. The other complaints was the cramps in the calves of both the both the legs at night. So this was another second complaint. Now, after the proper case taking, just going through it, past history revealed that she suffered from some nephrotic syndrome at the age of 5 years, and as per the history, she was got the protocol of penicillin injection as was desired in nephrotic syndrome. So that course of long-term injection she had to pass through, and that is why in the childhood there was a lot of ill health situation before this nephrotic syndrome. And next, there was also a remarkable history of dog bite, which was just 2 years ago, and she also took the scheduled course of anti-rabies vaccine, and which was completed. Family history: mother suffered from low back pain, and nothing that significant mother is suffering from at present. Father was suffering also from some chronic allergic rhinitis. And regarding the personal history, she was actually a student of class 6 and quite good in studies. And she liked painting and dancing during her leisure times. This was her basic hobbies. Regarding the generalities, she was very much lean, thin, and tall. Quite a ectomorphic feature. And weight was around 40 kgs. Height was quite good, 142 centimeter. It was good and regular. Desire aversion, nothing particular or significant could have elicited, because she was liking everything, no such aversion to particularly anything. So it was very nothing that much significant. But there was one intolerance which was quite significant, that was milk. And it was right quite from his childhood period, and which was having some GI upsets. So milk intolerance was quite an important feature. Regarding stool, which was not regular, and she passed stool once every 2 to 3 days, you can say in short that she has some constipation features. In urine, burning and heat sensation was quite often found around the urethra after maturation since the last 1 year. And thirst was quite adequate and normal. So in spite of normal thirst and adequate amount of intake of water, the burning sensation, heat sensation during maturation was there. So point which needs to be noted. Sweat was all over the body, but it occurred especially when she became anxious due to any cause. So sweat quite okay, occurring all over the body. But one point of notice was that the sweating becomes, increases when she becomes quite anxious due to any particular reason. Thermal reaction, it was actually neither hot, neither cold, so it's ambithermal. Mental generals, it was something like this, that she was very much disciplined and appeared to be unruffled when sitting quietly. But during conversation, it was found that she was very much anxious expression. So anxiousness is pretty much there in his character, in her character. And actions and reactions every time when something was asked, she fumbled. So this was actually noticeable to me when she came for the first time during case taking, when I did do OPD. Where whatever I was asking, his mother was actually telling me the answer most often. And when I told him to answer rather than not expecting his mother to reply, it was found that she was actually fumbling. She was actually getting a little bit anxious, expressions were becoming different when I was asking him to say the answer of the questions rather than not letting her mother to say. So this was something which I note that she was not very much confident in front of strangers as her mother told. So this was a little bit of uh, confusion also there in her mind when somebody directly questions her suddenly in strange situation. And this was quite evident when her parents also informed me regarding this point. That moreover, her parents also informed that she was actually very much studious in studies, but very often she gets distracted and lack concentration at studies. So this distraction, absent-minded or distraction, whatever you can say, it was found that sitting at one place, focusing on the target, was just not our cup of tea. So this is something which was important, and it might happen in childhood due to many reasons. But there was no particular reason, as I found during case taking. But this was something which was observable, something noticeable. That though she was very much good in studies, which dedicated, hardworking, but the lack of concentration and distraction was pretty much there in the studies. And constantly sitting hours for a work or behind something was just not her cup of tea. So this was just the mental makeup of 12 years girl who was developing through his school days. Now, the particular thing which I have already discussed much in detail, just once again, cystic swelling was observed on the right side of the floor of the mouth, underneath the tongue, you can say. It was reddish in appearance with a smooth glistening surface and having a visible dilated blood capillaries, veins on the surface. It was in continuation with the mucous membrane of the dorsal surface of the mouth. And the size was quite big enough that it was coming from the posterior aspect of the teeth. It was brimming over, as we have already seen, that the size of the ranula, you can see it was already coming over the teeth. It was coming in front, from behind, in front of the teeth, it was coming out. So that is to be taken into account to understand that how much bigger the size was. So, and other cystic swelling, I also mentioned repeatedly. So that was also there. And on palpation, it was basically soft, non-tender, mucous membrane freely mobile, And transillumination and fluctuation was quite positive, as I told you, which was an important point of demarcation for ranula from cystic swellings. Cross fluctuation was, however, not found, which was important because cross fluctuations, if it was found, if it was elicited, or it was found, or whether it was palpable under mandible, that could have been controversy along with a simple ranula and a plunging ranula, which I just showed in the beginning. But from that, the other systemic examinations revealed nothing as such. It was quite normal. So ultimately, the analysis of the case, if I come to the shortlisting of the whole thing, it is that mental anxiety when speaking. This was what I was just trying to highlight, that whenever she was asked to speak, he was asked a question, there was an anxiety expressions all over her face, all over the body language. Suddenly from a calm and quietness become anxious. So that mental anxiety when speaking is something with very much to be taken into account as a mental general. Next, concentration difficult. That is again a very important thing for her. Though she was so much good in studies, but that distraction was very much which important mental general for her. Next, the intolerance after milk, which cannot be ignored, as I told you, because out of many things, that intolerance of milk was very much important in her physical general symptoms. Constipation, yeah, it was marked, so that has to be taken. Burning during micturition, yeah, that was also something. In spite of a normal thirst, in spite of a normal intake of food, in normal intake of water, there was burning and a heat sensation during micturition. So burning during micturition, this was the symptom which was taken. Perspiration when getting anxious, again something related with the anxiousness, and that was perspiration, means a mental symptom having a physical manifestation. So you have to take in that way. So perspiration when getting anxious. Cramps of calf muscles at night, which is another complaint, as you know, means the particular two complaint was basically ranula, the cystic swelling, and the cramps of the cuffs at the night. So these two particular, which I have written last, because this followed the normal Kentian classification of symptom, that is mental generals to be followed by physical generals to be followed by particular symptom. Okay, the miasmatic analysis. Miasmatic analysis, basically, if you you may follow many books, but my suggestion will be to follow the R.P. Patel miasm book of chronic miasm, which actually analyzes the rubrics in Kent repertory. And the analysis has been done after consultation of several books which deals with chronic miasms. And whatever references that book in book of R.P. Patel have given regarding the particular symptom, the particular rubric and the miasm, it has been enlisted, means it has been referenced, tagged, and you can understand in which reference, which symptom is told to be soda, psychosis, or syphilis, or soda. So in that way, you can actually go through many books in one shot by going through R.P. Patel chronism book. And I have made this analysis following that book only. And according to that book, the same which I just said, for example, the anxiety when speaking actually was referred as soda. Next, concentration difficult for mind, it may be a sodic symptom, monocycotic, or syphilitic, or latent soda. As per the discussions, as per the references taken from different books. Stomach indigestion after it's purely soda, rectum constipation soda, as well as latent soda. Urine burning is mainly psychotic, as per the reference text. Extremities, cramps, calf muscles, it's soda. Perspiration, anxiety during, it's again soda. And mouth ranula, it's given as latent soda. It might be a confusion for many, because ranula, which is a cystic swelling most of the time we generally consider to be psychotic. But again, I am telling, this is as per the reference which was available in the R.P. Patel miasm book. Otherwise, the normal conception of psychosis miasm, as we know, whenever growth is there, so we generally consider it to be is a psychotic miasm. But consider the total miasmatic analysis, you will find it's basically soda, as we always that it's soda, the basic platform. And upon that, you can see there are psychotic features. A little psychotic features are there overall. So in that way, this is an understanding that this will be this case generally had a predominance of sodium miasm with some psychotic features. And next we had a repertory analysis. The repertory analysis was as per the Kent repertory, which I am saying, sixth edition of Kent repertory. And we generally used, I generally use the Homeopathy software for doing it. And as you can see, the analysis came down to the selection of amblyophagia. And there are a few drugs. Even you can see it is basically 1, 2, 3, or 6 in the sixth position. In this case, Thuja is also there, but in the sixth position. And as I am telling you, as per the Materia Medica books, if you do the books which deals with the clinical Materia Medica or the clinical repertory, if you go through, you will find that Ranula basically contains two drugs. That is, one is amblyophagia and another one is Thuja. And both of them, as per this repertory, are in the first top 6. But as you know, the rules of repertory, generally the highest scorer be finally matched with Materia Medica for final selection. And there was no doubt for me to with amblyophagia because the features are telling, the totality is actually indicating, and at the same time, it's also having a sodic predominance. And amblyophagia, as we all know, that it's a sodic remedy mainly, which was given by Hahnemann in his Materia Medica Pura. You can see that this is the page for Materia Medica Pura. We generally have 16 pages of amblyophagia in our Materia Medica Pura Volume 1. This is how it looked like ambra. And you can see the lines which I've actually highlighted, that this amblyophagia from the general class general class drugstores is very much difficult to obtain in a very pure form. And it was written in that time in the 19th century that the true ambergris developed actually in the intestine of the sperm whale. We know this whole ambergris, it comes from intestine of the sperm whale, and it has been proved by sweat jar, and probably it's a fatty excretion from its gallbladder, and is obtained best from the best quality from the sea, especially stormy weather. You can go through the textual reference. This is Materia Medica Pura, Volume 1, page number probably 47, and there are 16 pages of amblyophagia, means all the proving symptoms of amblyophagia. And probably you know that there is a controversy regarding the first nosode proved by Hahnemann. Somebody say that the first nosode is actually proved in 1827, which is actually amblyophagia. But some other stalwarts have a different opinion. They say that it's basically Sorainum, which is the first nosode proved by Hahnemann. Though, as we all know, that Sorainum was actually proved. It was completed by Dr. Herring. And that's why the total number of drugs proved by Hahnemann is 99 or 100. That's something in between. So leaving behind the histories, this is what is amblyophagia. And this is the drug for this particular case, and why this particular case deserves amblyophagia in front of you after so many analysis. I think it is quite clear for you now. And this is the starting. I started with 30C, 1 gram. I prescribed in globules. Globule number 30 it was, and it was very simple administration. It was 4 globules to be taken twice daily before meal, and it was, and the rest of the means after 1 gram when he finishes, another a few placebos were given so that for the rest of the month the child can continue the medicine. So this was the first baseline picture which I am showing you from the first slide. Now this is the first follow-up, second follow-up, and within 3 follow-ups the case turns out to be a cure. And you can see the follow-up dates practically what I want to show you, that first date of visit was actually 4th April. And the second follow-up, it was quite in time. It was in the 2nd May. And then again, the patient came on 6th of June. And then you see the date of the 3rd follow-up, that is in the December. So actually what happened, which happens in many cases with all of us, that due to cure, the patient doesn't turn up. And this also happened in this case, that when actually after June, the patient came to me in June, and you can see as in the follow-up chart, I actually continued with placebo for the rest of the 2 months as well, because as you know, as per our directions in Organon, in aphorism 245, it's clearly mentioned that as long as improvement continues, no repetition to be made. So that is a golden rule which you should follow in practice. And accordingly, I also prescribe placebo for the rest of the 2 months, because constantly the size of the ranula was decreasing every time she came to me in May and June. Along with the other general features are also a little bit improving. So it's not just a specific remedy for this case, which might appear to many. Means when you say that, oh, it was a case of ranula, it got cured by Gracia. So people might say, oh, it was a specific treatment. It's not a specific prescription. That what I want to say. As per number aphorism 147, you can clearly understand that this is a specific remedy for the particular disease. And this was designed after going through the totality, after going through the miasmatic and repertory analysis, and ultimately stand out the totality and became the ultimate selected medicine. And accordingly, that's why you can see the improvement not only in ranula, it was an overall improvement. The stool was not passed daily, but occurring frequently than before. Now it is a little bit improving. The burning improved a little bit. In the next follow-up, what happened? You can see the size of the other swelling also was decreasing. Stool, which was not occurring daily, but now it's still not occurring daily. Sorry, stool, there was improvement, not that much marked. Sorry, but urination, it was the burning sensation in urination that was pretty much improving. And so you can say that it was an overall improvement, which was later on shown by Naranjo's criteria also, that there was an overall improvement of the patient along with the main complaint, the main local malady. And in December, ultimately, when the patient came, but came with some other problems, some GI upsets, there was some indigestion after eating meat, and accordingly, pulsatilla was prescribed. But actually, due to cyst, she actually due to cyst, she was not coming because the cyst already disappeared. So actually, when I asked him when the cyst actually disappeared, she said that after the last visit, few days after the last visit, the cyst disappeared. So it was clearly evident that within a span of 2 to 3 months, the cyst disappeared, and hence the patient didn't understand the importance of following up when it got cured. And she came with some other complaint very much later on, 6 months later. So it was the real picture of the situation. And this was the second visit in the May. You can see the cyst was decreasing. You can clearly see the difference of the first picture with the second picture, because just see the granular size. The size which was exceeding, which was going over the teeth in the first visit, is now see it is within the teeth. It is now not crossing the level of the teeth. So you can understand the size of the ranula has decreased. The cystic swelling of the other cystic swelling of the lip, that is also decreasing. You can see and compare with the first picture and then the second picture. And lastly, if you see the third picture, means this was the second follow-up in the month of June, where the cyst very increased, and the cyst in the lip also almost disappearing, but still there is a little bit, you can see. And lastly, when the patient came in December due to some other cause, I took the picture just to make everybody understand that patient ultimately got totally cured. You can see the cyst underneath the tongue no longer appearing. Even the cyst within the lip, that is also not visible. So it is totally cured. In the month of December, when she came, I took the photograph just to make ensure that it was a completed case, cured case of ranula. So coming to conclusion, then in modern medicine, surgery is basically the mainstay of management of these cases, and recommendations for the preferred approach and techniques are quite variable, from simple marsupialization to excision of the sublingual gland along with the cyst. Homeopathy being an effective method of healing, it has been found to avoid surgery in the numerous clinical conditions. In the age of the surgeon, Hahnemann's emphatic demand still holds. That is, the patient should be healed rather than disfiguring the products of the disease, because to be the end of all treatment. The above illustrated case of two cystic swelling is one more example of the changes and the morbid alterations that appear on the external parts of the body and which gets removed by internal medication only. Hence, with homeopathy, invasive treatment may be avoided in such cases of ranula. So this is just an example to show you that ranula, especially simple ranula, I'm not talking about plunging ranula. Once again, I'm repeating, plunging ranula may be very difficult to get only with medicine, but simple ranula, we homeopaths can always have a try and achieve success. With this, I want to show you that this case got published in one of the important peer review journal in our India, that is Indian Journal Research in Homeopathy. And this is the publication page, and you can go to the publication, you can refer to the whole thing, which I just went through in form of slides. And this is the reference given in the top of the slide. You can just click and you can go through and see the case, which is published and available in the internet as well. So thank you all of you who are listening and have given me the opportunity to make my presentation. And once again, thank you all.
Thank you, Dr. Partha Pratim. And now it is the time for the questions. Those who wanted to ask questions, you can raise your hands. We will give an opportunity to talk with Dr. Partha Pratim. No one raised hand. I think everyone understand your presentation, I think. Thank you so much.
I hope so everybody was listening and it was comprehensible.
Dr. Manoj, you can ask question now.
Yes, thank you, Dr. Aditi, for giving an opportunity to talk with Dr. Partha. It's not a question, but about we must question ourselves, because we have done a lot of dedications and reading on this aspect, especially when you heard about the Dr. R.B. Patel's book on the miasmatic liver. It's very nice book. Recently or presently, nobody is not bothering about all that things. Very good number of results and researches where you have done, and also you publish the case in journals. That is also very important. A very important step, especially you are doing a lot of readings, and as well as you always kept on the mainstream in concerns with the writings of Heinemann's organons. Very good thing. Congratulations, keep it up, Doctor. Thank you.
Thank you, sir. Thank you a lot for your appreciation. Thank you, sir.
Can I ask something?
Yes, sir. Before asking, Dr. Ismail said he's the president of IFPH and he's the backbone of IFPH, and he's the former principal.
But my backbone is damaged.
Okay,
sir, you can ask question now.
See, the Ranula is a rare disease, but I have got a lot of one. I was made a conclusion of this disease. I'm not going to any other medicines. I'm giving only Ambra Gracia 10 2 doses. And within 15 to 20 days, it is appearing. Most of the cases, Ambra Gracia 10. I think you are young. You try the 10 potency next time. I think you will get a good action and very speedy action. I think so.
Thank you, sir. Thank you a lot for the suggestion. This is actually what I want everyone to know. This is how we can actually enrich all of us. So this is really a wonderful saying, sir. Thank you. Thanks a lot, sir.
Thank you, Dr. Ismail.
Most of it come to the lip also. This action is coming. And under the tongue and inside the tongue, as well as the lips. Most of it is coming.
Okay, sir. Okay.
Thank you, sir. Now, for giving out of thanks to Dr. I'm inviting Dr. Nutan Sharma for giving out of thanks. She's constantly supporting IFPH, and she's, I think she's available here.
Yes,
Nutan Sharma, please.
Yes. Good evening, one and all.
Control.
So, good evening, one and all, and Dr. Ismail, sir. I agree with you that nosodes and sarcodes act very well in high potency, above 1 m or 10 m. So this is my personal experience. Yes, it was wonderful evening. I would like to thank all the participants and all the delegates for today's meeting, for contributing largely towards homeopathy and towards the homeo physicians society as a whole globally. I would especially like to thank my dear Dr. Partha Pratim for enlightening us, all of us, with his extensive knowledge and research work on such a rare disease. So thank you one and all. Thank you, Dr. Shaji sir, for giving me an opportunity to thank everyone. Thank you and good night.
Thank you, Dr. Nautan Sharma, for
Thank
your
you.
vote of thanks and your support. Always you're supporting us. Thank
I'm
you.
always there for homeopathy.
Okay, thank you.
Okay.
And
Thank you, Dr. Nautan, for your enormous support. And also, once again, thank you, Dr. Partha Pratim for your availability with a short notice. Thank you for that. And I wish to make an announcement that our 365-day celebration is very near, and we will be having a short late meeting tonight after our Malayalam session for a very short period, because we are yet to finalize our conclusions about how to celebrate our 365 days of meeting because of lack of quorum in our meetings. And I appreciate those steering committee members and 365-day celebration committee members are requested to join our meeting after the Malayalam session. And we are conducting a competition as part of our 365-day celebrations among the homeopathic medical institutions in Kerala. And we need some sponsorship for the prizes and also for the payment of judges and other matters. So we appreciate those who are participating in the program, and regular supporters of homeopathy should come forward and generously support our endeavors. So our steering committee members may approach you to give a request for your support, and you should support our financially through our secretary or through our treasurer, whose account details will be available upon request. And we are also planning to send a notice to the Secretary of Health of Government of Kerala for legally making legally valid the certificate issued by the homeopathic doctors. I request all homeopathy doctors in India should issue to those common man who are taking and trusting in homeopathy for the prevention of COVID-19. We are legally allowed to do so. We have a general guideline issued by the Ministry of Ayush, and Supreme Court also allowed us to give homeopathic prophylaxis or immune booster medicine or preventive to our citizens in India, those who desire to do so. So we are authorized to issue certificates also to certify that the people who know that we are doing in those who are taking such preventives are doing so. So we should implement the authority vested upon us as homeopathic registered doctors to support the people who need homeopathy by issuing their COVID-19 preventive or immune booster certificate. A sample of such a certificate is available in our WhatsApp group, so those who need it can be reached out to us, any of our officials of our IFPH, to get a sample of such a certification. So we should all issue, and if anybody refuses to accept our certification, we should ask them to give the reasons for rejecting our certificate in writing, because we are issuing our certificates with the government order of the Ministry of and also the respective Supreme Court order authorizing us to provide such prophylaxis measures as guided by Ministry of Ayush. So this certification is valid only in India, and we should help our homeopathic supporters and patients and those who are taking by constantly issuing our certifications to those who deserve it. With this, I hand over the session to the Malayalam moderator for the beginning of the next session.